Good afternoon and welcome to today's Ask the Expert. I'm Anita McKenzie and I'm the support group leader coordinator at SADAG. So today we're going to take a look at the impact of chronic illness on mental health. And please join me in welcoming two of our special guests. Firstly, we have Dr. Patrick Ngosa-Poti, and he is the chairperson of the Diabetes Alliance. I'm just going to give you a little bio on him just now. We also have with us the lovely Courtney Sandham, and she's a SADAG support group leader, and she's been with us for a while. So, Dr. Patrick is a co-founder of the University of Pretoria Diabetes Research Center, and he's also currently serving as the chairperson of the Diabetes Alliance and convener of the South African Diabetes Summit. He's also part of the Gauteng Provincial Non-Communicable Diseases, which is the NCD, and Advisory Committee in South Africa. He brings 2 decades of expertise in global health, focusing on non-communicable diseases. So welcome, Dr. Patrick. Thank you for joining us today. And then we have, thank you. And we have Courtney. Courtney comes with 14 years of experience living with type 1 diabetes. Courtney has focused on critical intersection of mental health and diabetes care. Her honors research at the Northwest University explored how self-compassion enhances outcomes for individuals with diabetes. As a facilitator for a support group through SADAG, Courtney advocates for integration of mental health support into diabetes management, thus aiming to provide and help individuals better handle both their diabetes and the associated emotional challenges. So Courtney, thank you for joining us today.
Thank you for having me.
Okay, so yes, with all our audience out there, and I'm so sure that they are just wanting to hear all about what we have in store for them today. So I know we have a lot to talk about, and we're going to try our best to get through as much as we can. So Dr. Patrick, may I direct this question at you? So from a public mental health point of view, why is it important to include mental health care in managing chronic diseases like diabetes or hypertension?
Thank you. Thank you very much for the question and for having us this afternoon. It's really an important point. And the question that you asked about the integration of mental health services in NCD care, it's really because both are connected. It's often that you find people with non-communicable diseases because of the pressure or because of the demands of living with those conditions, they start developing some mental health challenges. For example, they can get anxious, they can be overwhelmed, and so on. So it's important that we start looking them as a whole, rather than this is somebody with diabetes or this is somebody with hypertension. The thing is, when you are living with a chronic disease and you're starting having some challenges with your mental health, it will affect your self-care. As a result, the person is maybe not adhering to treatment as it should. If it's diabetes, maybe they are not monitoring their blood sugar as it should, and so on and so forth. And obviously, in return, that will impact the outcome in terms of the health outcome, and they might be exposed to complication. Therefore, it's important that in the facilities, as policymakers, we look at it as a same problem and we integrate the services so that routine screening is available for people with chronic diseases so that the issue can be identified and we can therefore do something about it.
Okay, thank you so much, Dr. Patrick, for that. And it just shows you how important it is for these people to be also aware of what is going on. So from a mental health perspective, how the chronic illness as well as mental health fit together and how to look at it thereafter. So thank you so much for that explanation. And may you tell us what are some of the barriers that prevents individuals from with chronic illness from getting medical health support in South Africa?
Well, thank you very much. The main thing that we can identify is really the fragmentation of care. People with diabetes or hypertension, they will access care at a specific department within the facility. And if they are not referred or if they don't request, they're not going to be seen as a whole. Therefore, you might require another additional appointment to be seen maybe by a psychologist or by a counselor and stuff like that. So the fragmentation of care is the main challenge. Obviously, we can also talk about the lack of human resources. We are not training enough counselors and enough psychologists in the country. Some of them are practicing in the private sector. As you know, in South Africa, we have that challenge where we have a well-equipped private sector and a depleted public sector. So that in itself, it's also a big challenge. But it's really also awareness from the healthcare providers and from the health system as a whole. We need to be aware that these conditions tend to go hand in hand. Therefore, when we design the services, when you have them in consultation, for example, a simple question, how are you doing? How are you coping? Can open can be an open way of opening the door to a conversation that might allow the healthcare provider to detect what can be the problem from the mental health perspective. So those are the main challenges and some of the solutions that we can propose to address them.
Thank you, Dr. Patrick. I hear that, and that is a big challenge looking at it, whether it's the government hospitals or whether it's the private sector. And we look at that on a daily basis and talking to people with their experiences as well. And when you talk about like limited resources, it actually shows us that, you know what, we do have problems, when it's coming to afford the help and the mental health care that we can afford as well. And Courtney, maybe I can ask you to come in here with regards to people that Dr. Patrick was speaking about. Do you see many people in your support group that's actually gone for the therapy and gone for help and then come back to you as support, or can you tell us a little bit more about that?
Yes, I think that as Dr. Patrick also elicited to, the fact is that a lot of people that have chronic illnesses don't actually get the mental health support that they need, nor do they even recognize that they need the mental health support. And I think doing things like the support group have really brought about the mental health challenges that do come with living with a chronic condition. I think we taught as people living with conditions you only unfortunately realize the emotional toll it's taking and when it's too late. And I absolutely agree that starting health doing just that check-in, even from family and friends, makes such a difference in terms of helping manage the mental health aspects of living with a chronic condition.
Okay, thank you for that, Courtney. And how would you describe the mental health emotional journey of so many people that experience after they've been diagnosed with a lifelong condition like diabetes within your support groups as well?
I think what I've definitely seen is that people tend to go through almost a grief process. I think there's this grief of the life that you used to live. There's the loss of being able to kind of have this a bit of spontaneity almost, because there's such responsibility that comes with living with a chronic condition. And I think it takes a while for that foreverness to actually sink in and for it to become a known, and I think is the hardest part. And it's definitely not a final destination. I mean, I've had diabetes for 14 going 15 years now. And there are some days where I just do not want to have diabetes. And I think that I've seen that with a lot of my support group members is that, 1 week you feel on top of things, you feel like you're in control, and the next week it's like the absolute last thing you want to be doing. And beyond that, I think it also completely redefines your identity. You have to learn how to live with diabetes and for it to not become who you are as a person. And I've definitely seen in the support group that with the members, that we get to build resilience together, because resilience isn't something that you're born with. It's something that you learn to do, and you learn to wake up every day and live with your chronic condition.
Yeah. Courtney, thank you so much for that. And I'm so glad that, with the support groups that we have for diabetes as well, it's that safe space that's being created for people knowing that, what, it's okay. There are people that's going through similar things that I'm going through. It's a safe space where they can come, they can talk. And also, they're not going to be judged there. And like you said, it's something that goes on, and you might feel emotional today. Tomorrow you might be okay. It's something that you live in with. It's become a way of life, and it's so important. And I'm sure you, with the condition as well, you can look at your support group, and you have the members that you can talk to and you can confide in, and these things just help people, knowing that there's the support out there for them. And we're really grateful to you and the support group that you have, and the space that you hold for your members. So thank you for that, Courtney.
Thank you. It's actually been quite transformative for me too.
Yes, yes. And that's what the support groups are there. It's people with lived experiences helping each other to get through that. And that's what's so amazing about it. So, yeah, thank you. Dr. Patrick, with that said, can you tell us what our public sector is doing, from a mental health perspective, for people with chronic mental illnesses, and what could we do better?
I think what is at least there's some availability of services. It might not be widespread, or it might not be everywhere. Obviously, I might not have enough experience in terms of areas like Pumalanga or Limpopo or in the Eastern Cape. But in the main, in South Africa, primary care is accessible for free. So that's one. It's just really about us, as we are having this kind of conversation, as we are advocating to start, and I'm glad to see that in the recent years, mental health has come to the fore more and more. We have realized after COVID that human beings are not robots. You are a human being, as we say, and we have psychological and mental health issues that can be some severe, some can be minor. But nonetheless, once we advocate, once we make more noise, the service become more available. But beyond the availability of services, there's always also the stigma around mental health. I think one thing that we can do more in terms of South Africa, African countries, is to address the stigma around mental health, to make it okay for people to consult when they have mental health issues, to make it okay for people to voice and to be vocal about it, to join support groups and stuff like that. Once then people are comfortable expressing and being vulnerable about their mental health, they will be seeking care, and therefore the government, the health system will have to respond and make more service available. So in short, in answering your question, we need to do more awareness. We need to address stigma, but also obviously the government should train more psychologists and make the services easily accessible to people. The beauty is that we can use technology. We don't have to necessarily have one-on-one, face-to-face consultation. There are new things that can be done with digital health and others. I think those should be explored in order to make the service widely available.
Thank you, Dr. Patrick. And you bring a great point across. It's, what, with the mental health, it's breaking that stigma and making it's okay to not be okay. It's breaking that stigma. And I like what you say when you say that, by creating this awareness, and it doesn't have to be just one-on-one. And, we have the technology, we can do like Zoom sessions, etc. And we look at it like you said just now, pre-COVID, we also didn't have these sessions where you could do Zoom sessions and Zoom meetings online, and now we can do it. And what a better way of looking at it and helping people by just having these sessions, by creating the awareness, like you said, as well, and breaking that stigma. I think by creating that awareness, like you said, it's really, really amazing in ways that we can reach out to many people out there. So thank you so much for sharing that. And with that said, leads me to my next question to you. What message would you like policymakers and funders to understand about investing in mental health in this important chronic disease of diabetes?
Oh, thank you for the question. Yeah, in general, chronic care in Africa and in South Africa is underfunded. So our message would therefore be for more investment and more funding. We actually want to call it investment rather than just expenditures, because what you are doing when you are investing or when you are spending in NCDs, especially in mental health, you are preventing other problems down the line. We mentioned earlier that due to the burden of living with chronic conditions, people living with those conditions tend to develop mental health issues. If they are not addressed, it will worsen the outcome of their health. And then we have complications. In the case of diabetes, you might have people getting into kidney failures, you might have people getting into heart problems and issues with the eyes and amputation and so on and so forth. Those are very expensive complications to manage. If you invest more into screening and management of those mental health conditions, especially when they are not severe, we are then able to prevent bigger problems down the line. That's why we describe it as being an investment. Therefore, my call really for policymakers, decision makers, or funders is to understand that funding NCDs is an investment. It leads to better productivity. You can imagine when somebody is supposed to be at work, focusing on their job because of their mental health challenges. Now they are distracted, they are feeling depressed, they are not giving their best. And the company is losing, the country is losing, the community is losing. So it's really about understanding that putting money, funding NCDs and mental health is an investment for a healthier society and a productive society. So that will be, in the short, my main point. The second that will be obviously to have a healthcare system, mainly at the primary care level, that is aware of these challenges, where screening is happening as a routine care, not as a by the way, and where the healthcare providers are trained into responding to those matters. That's why, as the Diabetes Alliance, coming in November, we are having a master class for healthcare professionals in order for them to understand the connection between diabetes and mental health, but also to know what is it that they can do with the limited resources that they have at the primary care clinic. So that's really the type of movement that we want to see in that space.
Wow. Wow. Thank you, Dr. Patrick. And like you say, it's an investment into our society. And it's so important, like also having these conditions picked up as early as possible so that you can, take the necessary precautions and do what needs to be done in those cases. So thank you so much. And I'm going to come back to the Diabetes Summit in a few minutes. So Courtney, just based on the lovely information that Dr. Patrick has given us, I just want to take this back to you, to your members. And so often people pick up that, with a chronic illness comes like all these mental health conditions. And with any chronic illness at the end of the day, not just diabetes, and it impacts on our mental health. So there's often a silent emotional burden that comes with invisible conditions. When people look fine on the inside, how does that affect relationships, social life, and mental health from a support group perspective of your members?
That's such a good question. I think what I've noticed in my support group is that, especially with diabetes and a lot of chronic conditions, visibly you don't look ill. You look fine. And so it's very easy for people to assume that you're fine. And they don't see the stress that goes into the calculations of how much insulin to bolus, the stress of having a high or low blood sugar when you don't want one. And so I think what I've noticed, a lot of the problem that comes in relationships is that at the beginning, people are very accommodating because it's a new thing. It's people are wanting to help and support you as best they can. But because of the chronicity and longevity of chronic conditions, that fades eventually. I think people get a bit of burnout as caregivers also, and as friends and family. They almost forget, it falls into the background. And then the person living with the chronic condition is left themselves to have to do the calculations, to have to suffer. And I think the beautiful thing about the support group is that it's people that can relate, as we mentioned earlier. It makes it normalize the fact that you wake up some days and you want to throw your insulin across the room, and it makes you feel a little bit less alone in the struggle. And I think the point to highlight is that I don't think a lot of people with chronic conditions, what I've noticed, especially my support group, is that they're not looking for sympathy. It's just understanding that we're wanting. It's the asking if we're okay, as Dr. Patrick mentioned earlier. It's just the check-in that just really helps build that relationship and the understanding.
Thank you, Courtney. You know, that's just so profound. But you know, like it's just like you said, that understanding, that knowing what someone else is going through. And it just brings me to the next point that I want to make. It's like, what are some of the misconceptions people have about living with a chronic illness that makes it harder for patients to get the understanding and the empathy that they actually need from others?
I think I can speak to diabetes on this one. Other chronic illnesses, I'll leave to Patrick to discuss. But I think I've noticed with type 1 diabetes is that there's a very much a lack of it. And I imagine it's the same with a lot of chronic conditions. And so a lot of people think that managing diabetes just comes down to willpower or a lifestyle change, or if I behave well and follow my diet and inject, my diabetes will be fine. And with diabetes, it's definitely not like that. Some days your sugars are just on their own mission in life. You can do the exact same thing you did yesterday, and today they will be all over the show. And I think there's that misconception of, oh, you did this to yourself. Whereas a lot of the time, and a lot across chronic conditions, a lot of the time it's genetic, it's hereditary, it's not something you chose to have. And I think neglecting the fact that it happened to you and it's not something that you willed makes that misunderstanding so deep. It makes you feel so invalidated. Yeah, and I noticed that's come up a lot in the support group is the misconceptions and the miseducation around particularly diabetes.
Yeah, thank you so much, Courtney, for that. Dr. Patrick, would you like to add on something from that perspective, or maybe not from a diabetes, but another chronic disease perspective, or do you feel it's the same situation?
No, I think the reflection that I'm having, listening to Connie, and I might have made the point previously, when you asked about what message we should give to policymakers and funders, I think the first message should be for them to listen to people with lived experience. We take a lot of things for granted because we are not walking that journey. We are not in their shoes. But the first effort that a policymaker, that a funder can make in listening to people with lived experience will change their perspective. That's what happened to me when in one workshop I once listened to people with diabetes having a panel discussion. I realized that there's a whole dimension that for us in the back, we only focus, as a doctor, you focus about sugar. What is the number? What is the HbA1c? Is the blood pressure under control? We forget that we are talking to a person. So I think it's important that, as we say, the global movement of nothing for us without us, it's important that people with lived experience have a seat at the table because they bring that perspective and they bring that story that open your eyes and make you realize that, oh, I've been putting together health services, but I completely forgot about mental health. And when you listen, it reminds you, and having them suggesting solutions. How should we address mental health when it comes to diabetes? How can we improve the services? Is really an insight that we shouldn't take for granted. So that will be my 2 cents on that.
And that. Thank you so much, Dr. Patrick. And you know, it just makes so much of a difference when you look at people with lived experiences to go through. And like you say, you know, you look at it from a GP's perspective, if you look at it from a different perspective, but looking at it holistically from all the different aspects. And I think that is just something that we need to talk about. And going back to the diabetes summit that's coming up, I know you're looking at all the different areas. We've had a peek into it, and maybe I know you have told us a little bit about it. So in maybe just one sentence, what can you tell us about the summit under the theme Innovate for Impact, which is your theme? Can you tell us a little bit more at what you aim to achieve?
No, thank you very much. Yeah, the Diabetes Summit is an event organized by the Diabetes Alliance with various partners, for example, Department of Health, WHO, World Diabetes Foundation, South African Medical Research Councils, and others. The idea is really to set a table for a conversation around diabetes in the country. Diabetes is such a complex condition that touch on various things. It touch on food, it touch on the way we monitor, it touch on the way we live, it touch on our emotions and so many things. Therefore, we cannot leave it in the hands of the Department of Health to address the burden of diabetes. For the listeners, diabetes is currently one of the leading causes of death, not to say the leading cause of death in the country. And we have a number of cases still being diagnosed every day. So it's really a disease that is reaching crisis proportions. So at the summit, we bring together the whole of South Africa, meaning partners, health care providers, advocates, especially people living with diabetes themselves, to discuss what can we do as a country to respond to this big challenge. So yeah, I invite everybody who is interested to go to the Diabetes Alliance website for further information. We're very excited. The program is really exciting. There's a lot of speakers. With our colleague from SADAG, we'll have a half-day workshop on peer support. So whether you are living with diabetes or you are healthcare providers, we are calling on you to join us from the 11th to the 13th of November at the Radisson Hotel and Convention Center in Johannesburg.
Dr. Patrick, thank you so much for that explanation. And you know what? It's that awareness that's being created through this, and it's amazing. All the time and the effort and the research and the resources that's gone into this event, and it's not just from one aspect. It's holistic. And we're looking forward to that summit. So thank you so much for that. And like Dr. Patrick said, if anybody's interested, you're more than welcome to visit the website. Courtney, I just want to ask you, when it comes to self-care and looking at someone with a chronic condition, what are some of the practical or emotional self-care practices that you've seen that's made a difference? Maybe talk from your support group perspective.
Absolutely. I think joining the support group or a support group first off is such a good start. I think, as I said previously, it really does just normalize all the emotional ups and downs, all of the not so pretty sides of diabetes that you're too afraid to speak to your healthcare workers about. So I think having that connection really, really helps. And then I personally am super big on self-compassion, and we speak about it a lot in my support group. Diabetes, particularly, every chronic condition is a daily battle. It's a daily fight. And so after a tough day of not ideal blood sugars, to just learn to say, I'm doing my best and that's enough. Tomorrow's a new day. Having just that ability to come back, I think, is so important. I know, and also we spoke a lot in my support group about having boundaries. A lot of the time with chronic conditions, you get quite a lot of physical side effects. You're tired some days, you grumpy other day. Being able to communicate that with your loved ones and saying no when you need to say no is super important. But I think the drive home message really with any chronic condition is just finding a way that's sustainable. It needs to be small practices every day that just can get you through to the next day. We say on our support group all the time that it's day by day, and if day by day is too much, then it's hour by hour. Like, you literally just need to hold on, find that little bit of something to get you through to the next stage.
Courtney, thank you so much for that. And I think to everyone out there listening, it just shows you all the love and the emotion and everything that goes through, and also within your support groups, knowing that you have the environment that you can trust each other, support each other, and just be open and be yourself. And who else but then people that has a lived experience talking to each other. So thank you for that. Dr. Patrick, I've heard, okay, it's just like I've heard you, that stress can make chronic illness worse. Can you maybe explain how mental stress actually affects the body?
No, thank you very much for the question. Yeah, indeed. Stress makes everything difficult, obviously. That's why we're supposed to live a balanced life. It's because obviously when one is stressed, in terms of living with a chronic condition, Courtney maybe highlighted some of the demands that they have to deal with. You need to check what you eat. You need to remember to take your insulin or your tablets. You need to avoid certain things. You need to remember other things. So there is really a full-time job that they are living besides the life that all of us are already living. So you can imagine all that additional burden adds on, obviously, the mental pressure and psychological pressures that they can be going through. And that really obviously will affect the hormones or affect the body. And unfortunately, as I said earlier, have an impact on self-management and self-care, because as Courtney described, it's a battle. And sometimes you don't have the energy to fight. And sometimes worse, it could be a person who, when they were diagnosed maybe with diabetes or with cancer, they were not told about that pressure coming. So you feel like, oh, is it only me? Am I alone? Why is it that I don't see other people or talking about it or going through it? So that also adds to the guilt and the additional pressure. So that's why really when Courtney's talk about self-compassion, it's very critical for the people living with those conditions to be aware of that. So then when there's no then intervention, it becomes a vicious cycle. So, and obviously leading to poor outcomes. So it's important that the people living with the condition are trained, educated to understand what will eventually happen to their body, but also the healthcare system and the healthcare professionals are made aware of what they should do when they see some certain signs. So yeah, that's in short what contribution I can add.
Dr. Patrick, thank you so much for that. And like you said, it's that awareness so people know what's going to happen or know what the expectation is. You know, okay, fine, I've been diagnosed. Now what? You know, what should I do? How should I do it? Who can I talk to? What resources are available? So it's all of those, and like we said, it's creating that awareness, moving away from feeling guilty, because sometimes, like you said earlier, even Courtney, it's inherited. You get it. There's nothing you can do. You know, it's genetic. And so it's just, you know, okay, fine, this is what I've been diagnosed. How do I move forward from here? What do I do? And like having a support group, it's a great way. And I'm sure there's so many other resources out there as well for all our audiences listening in as well. And I'm just so glad that I have had this conversation with both of you. And this is something that's so close to my heart. I cannot go into the details, but it's just something that sits with me. And Courtney, I just want to say that I admire your strength and I admire what you're doing and the support group that you've created. And just from our conversation today, listening to everything that goes on and for you holding the space for the people that come to you, it's amazing. It's just so amazing knowing that they have a place, and for you to knowing that you have the place with your support group members, because like we said, it's we're there for each other, and I'm sure that helps you through what you're going through as well. And thank you so much for that. And Dr. Patrick, I just want to say thank you. Thank you for being here and sharing so much with us and creating the awareness. And it just makes me happy knowing that the summit's coming up and there's so much that's going to create the awareness for everybody out there that maybe feel stuck or maybe feel lonely or we don't know where to go or what to do. I think this awareness and these resources are going to be such a godsend, you know, to this. And thank you for being here today. So I'm going to just hand over if there's anything that you want to say before we wrap up.
On my side, thank you for the opportunity. Thank you to SADAG for the putting together the platform, for keeping the conversation alive. And yeah, to everybody out there, you're not alone. There are resources, there are people who care about you. So reach out and seek help if you feel you need help. And yeah, you can find us on the website of the Diabetes Alliance. And through the SADAG, obviously, you can reach out to us. We are there for you.
And Courtney, is there any? Thank you, Dr. Patrick, so much. Courtney?
I just also want to say thank you so much. I think when I started the support group, sure, it was a while ago now. Since then, it's so beautiful to see the growth and how many chronic condition support groups SADAG has launched since then. And I'm so grateful to see that also so much conversation around mental health and conditions. And I think for me, it's really been quite beautiful to see. And so I'm also very grateful for SADAG and everyone else's awareness that they're bringing to it all. It's nice to see that, you know, now that you have a chronic condition, you don't need to suffer in silence. There's conversations being had, there's solutions being attempted, and yeah, I'm excited to see where it goes from here.
Okay, Courtney, thank you. So that brings us to the end of our session. It's been such a great session. So to Courtney and to Dr. Patrick, thank you so much for making the time and for being here today. We really appreciate everything that you do. So thank you and take care. And bye.
Thank you.
Bye-bye.